Alabama currently faces a severe provider deficit in mental health care, creating a high-demand market for psychiatric mental health nurse practitioners, or PMHNPs. A PMHNP is an advanced practice nurse specifically trained to assess, diagnose, and treat mental health conditions. This chart illustrates the scale of the current crisis. Currently, only 28.4% of Alabama's mental health needs are being met. To eliminate its designated shortage areas, the state requires an additional 128 psychiatric practitioners. This supply and demand gap directly impacts compensation. While a general nurse practitioner in Alabama earns an average of $109,000, the average PMHNP salary is $191,064. This represents an $81,000 premium for specialized psychiatric expertise. To access this market, you must navigate a specific regulatory framework. Alabama is a reduced practice state, which requires career-long physician collaboration and oversight from two separate state boards. The high financial payoff in Alabama is tied directly to a practitioner's ability to maintain compliance within this multi-layered licensing bureaucracy. Step 1 is the educational baseline. You must graduate from a master's or doctorate program with a specific PMHNP focus. To qualify in Alabama, your graduate program must specifically include pharmacology coursework. Step 2 is passing the National Board Exam administered by the American Nurses Credentialing Center, or ANCC. You must maintain this PMHNP BC certification to remain eligible for state licensure. Step 3 is obtaining your Alabama Registered Nurse License. Alabama is part of the Nurse Licensure Compact, or NLC. This allows an RN with a license in one compact state to practice in other participating states. If you hold a multi-state license from another NLC state, it is valid for use here. While these initial steps follow national standards, they are only the prerequisites for entering Alabama's unique dual board system. Step 4 is applying for advanced practice certification. In Alabama, the legal title is CRNP, or Certified Registered Nurse Practitioner. You will not find standard NP designations on state forms. You must execute this step through the Alabama Board of Nursing's digital portal, which handles all advanced practice certifications. Step 5 is the critical compliance requirement, establishing a standard collaborative practice agreement with a physician. This agreement is not active until it is approved by both the Board of Nursing and the Board of Medical Examiners. This dual board oversight is a defining characteristic of the Alabama healthcare landscape. Note that these agreements are strictly setting-specific. If you change employers or add a second clinical site, you must refile the agreement and pay additional fees. In this state, your legal authority to practice is tied directly to your specific employer and physician collaborator. Step 6 covers controlled substance certificates. This stage requires significant forward planning because the state enforces a mandatory waiting period for all new practitioners. You must complete 12 months of safe clinical practice in Alabama before you are eligible to apply for the certificates required to prescribe controlled substances. Alabama uses a 3-tier system for prescriptive authority. The base level is legend drugs, authorized immediately. The middle tier, Schedule 3 through 5, requires a QACSC, obtained after your first year. The top tier, Schedule 2, requires an additional special permit from the ALBME. You also must maintain a standard federal DEA registration in addition to these state-specific permits. Finally, Step 7 is obtaining your National Provider Identifier, or NPI. This is a unique identification number for healthcare providers, which you can obtain for free via the CMS NPPES system. Full prescriptive authority in Alabama is a sequential process that requires both clinical experience and layered state approvals. Once you are licensed, you must maintain ongoing compliance with the 10% physician presence rule. This rule requires your collaborating physician to be physically on site for at least 10% of your scheduled hours. They are also required to conduct quarterly visits to each practice location. Telehealth is a viable option in Alabama. State Medicaid reimburses for live video care, and federal flexibilities for prescribing via telehealth are currently extended through late 2027. However, out-of-state practitioners must be aware that Alabama has not enacted the aprn compact. This means any remote practitioner treating patients in Alabama must hold a local CRNP license and maintain a local collaborative agreement. While Alabama supports modern care delivery, the state maintains strict control over its internal regulatory borders. The licensing process in Alabama requires patience, but the results are significant. Navigating these requirements leads to a $191,000 average salary and a direct role in addressing the state's mental health crisis. For the complete 2026 guidelines, salary data, and current job listings, visit PMHNPhiring.com. The regulatory requirements of the Alabama PMHNP license are precisely what preserve its high value in the market.